The Low Vision Aid Clinic is run by qualified optometrists from Oxford Eye Hospital. The aim of the clinic is to maximise the patient's visual potential and to ensure that they have as much independence as possible with regards to their sight loss. We also run a specific dedicated children's low vision clinic from Oxford Eye Hospital. A referral to the Low Vision Aid Clinic needs to be made by a professional. It can be made from the GP, it can be made by the community optometrist, or if the patient's already seen by the ophthalmology team at Oxford Eye Hospital, then it can be an internal referral from the ophthalmologists. The first thing that we do is ensure that their spectacle prescription is up to date and correct. After that, we do what we call a needs-based assessment. So we have a look at the vision that the patient has. We then look at magnifiers to optical aids to help bridge that gap and prescribe the most suitable magnifier or optical aids. Optical magnifiers are available free of charge to patients on loan, permanent loan, through the hospital eye service. So the clinics run every day of the week from Oxford Eye Hospital. They also run on set days of the month at peripheral locations around the county to make it easier for patients to travel to the clinic. We also then spend time signposting patients and their families to appropriate support services in the county or nationally to help support them with their sight loss. The Low Vision Aid Clinic is a crucial part of the low vision pathway for patients with sight loss in Oxfordshire.
The Visual Impairment team, Oxfordshire County Council, holds the sight impairment register. So when a certificate of visual impairment is completed at the eye hospital, that is then sent to us in social and community services. Quite often these are people that we don't know about. We don't know that they've got a problem with their vision. Once we get that certificate, we always make contact with that person, have a telephone call with them, see what kind of difficulties they're having, and if they would like us to, then we visit, carry out the assessment and provide services. Our team is made up of qualified rehabilitation officers for visual impairment, so we are trained specifically to work with people with visual difficulties. The majority of work we do with people is on a one-to-one level. So when a referral comes into the team, we'll carry out an assessment of their need. So that's then really looking at those day-to-day tasks that they're having difficulty with their visual impairment. So it's a specialist assessment focusing on visual impairment issues.
The association is the county charity for everybody in the county who has a visual impairment. Anybody is welcome, and we also very much try to support the families and the carers of the visually impaired person. We feel it's very important that we are available for people at the point of their appointments, and so we have a desk at the eye hospital where we provide advice and guidance, and also a point of referral onto other services. The hospital staff themselves, or the people at our eye desk, would refer you to us. Then you can telephone us or email us if that's your preference. We prefer it if people are able to come and see us. In that instance, we can talk at length about the difficulties that the person's having, and we're able to provide a range of advice and guidance for you. The other thing that we can do is to provide a look at the specialist equipment which is available. There's a wide range of equipment which helps people to manage, and we like to give people the opportunity to try out that equipment and to see if it's useful for them. We can then refer on if we feel that there are other services which may benefit the person.
Well, Guide Dogs, the charity, exists to enable blind and partially sighted people to get out and about and share the same freedom of movement as everyone else. It changed my life massively. My guide dog gives me a lot more confidence when out and about, and it's just really that confidence and trust, knowing that, you know, my guide dog's not going to walk me into obstacles or walk me out into the road, something that I would be very anxious about when using a cane.
We recognise that for some people the emotional difficulties they're having are a real barrier to them progressing with independence, and so in those instances it's very important to provide emotional support and, if necessary, counselling. Other people who come to see us are rather more practically minded, and they're looking for practical solutions to the difficulties they're having. And we feel that if we are good at listening to the person and the problems that they're experiencing, once we've dealt with those problems, we can move on and help people with some of the other issues which they perhaps hadn't realised that they could make progress in. We very much try to provide the information and the advice that family members and carers require in order to help the person be as independent as possible, and thereby to relieve the pressure on them.
Try and encourage the person that you're caring for to have as much independence as possible for as long as possible, even on occasions when you might just have to jolly them along and say, come on, look, you can do this. Because for your own protection and for theirs as well, you need to have some reserves. It's important that you don't exhaust yourself, otherwise your GP practice will have 2 patients at that house and not just 1.
Our main role is to try to enable visually impaired people to be as independent as they wish to be. And we do this in collaboration with the other agencies in the county who are working to the same aim. The main benefits to individuals is they are able to do things which perhaps otherwise they weren't thinking that they could do. People often find they're having difficulty with some aspect of their life, and we're able to give them some advice, information, or at least point them in the right direction if they need some specialist advice that we don't have access to.
When I was registered blind in 2003, it was just like every door had been shut and you thought, gosh, what do I do now? How am I going to manage? But there's so much here. You know, all of a sudden the world opens up again. You go into that resources room and there's everything you can think of that you might need. Although we're all different, and many people don't realise that people with sight problems are different to one another. They tend to think, oh, well, you know, give her a large print book and she'll cope. But it's much more than that. And there are so many useful little gadgets in there.
I do think that technology will develop and it will provide more opportunities for visually impaired people. We need to keep our eyes on those developments, but it's very clear that things like mobile phones and iPads have more potential than they've already achieved in terms of bringing opportunities to visually impaired people.
They've got time for you, which often doesn't happen when you go shopping, you know, but here they've got time for you.
The Low Vision Aid Clinic runs at Oxford Eye Hospital and at peripheral locations in the county. It is run by qualified hospital optometrists. There are separate clinics for adults and for children. The aim of the clinic is to maximise the patient's visual potential. The spectacle prescription will be checked and the patient will be assessed for magnifiers. Any magnifiers loaned are loaned on a free of charge basis. The optometrist will refer the patient to appropriate support services. The Eye Clinic Liaison Officer is based at Oxford Eye Hospital. They provide emotional support at the point of diagnosis and signpost on to support services. Referral to the Low Vision Aid Clinic is via the GP, ophthalmologist or community optometrist. Referral to the Eye Clinic Liaison Officer is by self-referral or by the ophthalmologist or hospital optometrist. The Eye Clinic Liaison Officer at the Eye Hospital coordinates the referrals to the team for sight impairment registration. The Visual Impairment Team, Oxfordshire County Council, is a statutory organisation that holds the sight impairment register for Oxfordshire. The team consists of rehabilitation officers and support workers. The team undertakes specialist assessments including independent living skills, communication skills and mobility training. They see adults and children. Referral is by self-referral or from a professional. Oxfordshire Association for the Blind is the county charity for sight impairment. The charity is based in Oxford and has a sight advisory desk at the Eye Hospital. OAB provides information, advice and specialist counselling. They also provide IT training and have a resource room to demonstrate and sell equipment. OAB have social groups throughout the county and have a home visiting service.